1 in 2 men over the age of 40 experiences some form of erectile difficulty. That is not a number meant to alarm you. It is a number meant to remind you that if you are struggling with erections, stamina, or performance, you are not alone. Yet most men suffer in silence. They hear whispers on social media about secret spots to press, mysterious massages, or miracle techniques that promise instant results. Some of these claims are misleading and some are downright dangerous. But what if there actually is a safe, research-supported way to use touch and massage to restore blood flow, calm nerves, and improve potency? That is what we are going to explore together today. When I work with men in my clinic, I often see the same pattern. They feel embarrassed, they wait too long to seek help, and by the time they come in, they are convinced something is broken beyond repair. But the truth is very different. The body is resilient. The nerves, muscles, and vessels that control erections can often be retrained, strengthened, and stimulated in ways that restore function. And sometimes the most powerful interventions are not pills or surgeries, but simple daily practices that reconnect you with your own body. One of the most overlooked approaches involves a very specific area of the body, the perineum. This is the small strip of tissue between the scrotum and the anus. It might not be something you have ever thought about, but in medical science, we know it plays a central role in erection quality, ejaculation control, and pelvic circulation. For centuries, in both Eastern and Western traditions, massage of this region has been used to enhance male vitality. Today, research is finally catching up, showing that targeted perineal massage, when performed correctly, can help with erectile dysfunction, prostate health, and even pelvic pain. Now, let me be clear from the start. There is no magical 1-minute fix. No doctor who respects you will promise that massaging a single spot will cure all your sexual concerns. But what is true, and what I want to show you today, is that activating this region can improve blood flow, wake up nerves, and train your pelvic muscles in ways that support potency. Think of it like rehabilitating an injured joint. You do not just take a pill to heal a knee. You stretch it, strengthen it, massage it, and retrain it. The penis and its surrounding structures deserve the same thoughtful care. So in this consultation-style session, we are going to break down the science behind this overlooked spot. We will talk about how the perineum connects to your prostate, your pelvic floor, and your erection reflex. We will review what the National Institutes of Health and leading urologists say about pelvic rehabilitation. We will explore how massage and touch can support nerve recovery and circulation. And finally, I will show you how to integrate a safe 1-minute per day practice into your routine without gimmicks, without shame, and without unrealistic expectations. If you have ever wondered whether there really is a simple body-based way to restore your potency, you are in the right place. By the end of this video, you will not just have an answer, you will have clarity, confidence, and a daily tool you can start using right away. Let us start with anatomy, because understanding your body is the first step to regaining control of it. The perineum, that area between the scrotum and the anus, may seem like nothing more than a patch of skin. But in reality, it is the gateway to some of the most important structures that control erections, ejaculation, and even urinary health. Beneath this region lie the bulbospongiosus and ischiocavernosus muscles, two major players in male sexual function. Imagine them as the support beams that help squeeze and trap blood inside the penis during an erection. When these muscles contract, they compress the base of the penis, allowing erections to stay firm. When they weaken, blood flow leaks out more easily, leading to softer or shorter lasting erections. The perineum also houses critical nerves, particularly branches of the pudendal nerve. This nerve carries signals between your brain, spinal cord, and genitals. It is essentially the communication line that tells your penis when to respond. If that pathway is sluggish or understimulated, erections can feel unreliable. But when you activate this area with targeted massage, you are essentially waking up that circuitry, much like flipping a switch to restore electrical current. Now let us talk circulation. The perineum is rich with vascular pathways that feed directly into the arteries of the penis and the venous plexus around the prostate. If you think of erections as a plumbing system, the perineum is the junction where the water pressure builds before rushing forward. Massage in this area has been shown to improve microcirculation, helping more oxygen-rich blood reach the erectile tissue. The National Institutes of Health has published studies on pelvic rehabilitation demonstrating how direct stimulation of these muscles and vessels can enhance erectile function over time. Think of it this way. If you leave a sponge sitting in one place for too long, it becomes dry, stiff, and less absorbent. But once you rinse it with fresh water, it becomes pliable again. In a similar way, the perineum needs healthy blood flow and nerve activity to stay responsive. Without it, things stagnate. With it, the tissues regain vitality. In clinical practice, I often remind men that they already know this principle from other parts of the body. You would not expect strong legs if you never walk. You would not expect flexible shoulders if you never stretch. The same rules apply here. The perineum, though hidden, is a working part of your sexual system. When you treat it with attention, you support the entire chain of erectile health. So the first takeaway is this. The perineum is not just an afterthought, it is a central hub for blood flow and nerve activity. And by learning how to stimulate it safely, you can reawaken functions that many men believe are lost. When men hear the word prostate, the first emotion is often fear. Fear of cancer, fear of surgery, fear of something going wrong with masculinity itself. But the prostate is not an enemy. It is a small walnut-sized gland that plays a vital role in sexual function. It produces the fluid that nourishes and protects sperm, and it sits right beneath the bladder, wrapping gently around the urethra like a protective collar. Here is where the perineum comes back into the picture. The prostate lies just a few centimeters inside the body, directly above the perineum. This means that when you apply gentle external pressure or massage to the perineum, you are indirectly stimulating the prostate gland. This is not speculation. This is anatomy. That is why in some parts of the world, perineal massage has been used as a complementary therapy for men with chronic prostatitis, pelvic pain, or urinary symptoms. The Mayo Clinic has documented that conditions such as chronic pelvic pain syndrome affect millions of men, often presenting as both urinary difficulty and sexual dysfunction. One contributing factor is congestion, a buildup of fluid and poor circulation in the prostate region. Research published in the National Library of Medicine suggests that therapies aimed at improving circulation and relaxing pelvic floor tension can reduce symptoms and improve sexual outcomes. Think of the prostate like a sponge. When circulation is poor, that sponge can become congested, swollen, and inflamed. Gentle perineal massage acts like squeezing and releasing that sponge, not in a literal sense, but in a circulatory sense. By encouraging blood and lymphatic flow, it helps reduce stagnation. Better flow means reduced inflammation, better oxygen delivery, and in many cases, improved comfort. In clinical practice, I see men who complain of dull aches in the pelvis, frequent urination at night, or a heavy feeling after intimacy. Often, pelvic congestion is part of the picture. By teaching them relaxation techniques, gentle massage, and targeted pelvic exercises, many report improvement not only in their urinary health, but also in their erections. The two are closely linked because the prostate and the erectile tissues share blood supply and nerve networks. It is important here to separate myth from fact. Some men worry that stimulating this area might be harmful or that it is unnatural. In truth, what is unnatural is ignoring a vital part of the body. Just like we encourage men to check their blood pressure or cholesterol, we should encourage them to care for the pelvic region. External perineal massage is safe, non-invasive, and well within the scope of self-care. The takeaway is this: supporting prostate health is not just about avoiding disease. It is about circulation, comfort, and function. Gentle perineal massage can help maintain a healthy flow through the pelvic region, reducing congestion and indirectly supporting both urinary and sexual health. If this is helping clarify things, give it a thumbs up and keep learning, because in the next section we will uncover how the pelvic floor muscles, often ignored, act as the hidden engine of erections. When most men think about muscles that affect sexual performance, they picture biceps, abs, or chest. But the truth is, the most important muscles for erections are ones you cannot see in the mirror. They are the pelvic floor muscles, and they sit beneath you like a hammock, stretching from the pubic bone in the front to the tailbone in the back. This hammock supports the bladder, prostate, and rectum, and it plays a direct role in erections. Two of the key muscles, the bulbus spongiosum and ischiocavenosus, are part of this group. When they contract, they squeeze the base of the penis and push blood forward, making erections firmer and more sustainable. They also help with ejaculation control. If these muscles weaken, erections lose rigidity, stamina declines, and men often notice increased urinary dribbling. Now, how does perineal massage fit in? The perineum is the surface doorway to these muscles. When you apply gentle pressure or massage here, you stimulate blood flow, activate the muscle fibers, and increase awareness of this hidden area. In clinical terms, this is called neuromuscular activation. In plain terms, it means you are waking up muscles that may have gone dormant from years of sitting, stress, or lack of targeted exercise. Research from the Journal of Urology has shown that pelvic floor rehabilitation, including massage, targeted contractions, and physiotherapy, can improve erectile function in men with mild to moderate erectile dysfunction. In fact, one study from the University of Bristol found that after 3 months of pelvic floor training, 40% of men regained normal erectile function and 35% showed significant improvement. That is nearly 3 out of every 4 men seeing measurable benefit without pills or surgery. Think of the pelvic floor like the foundation of a house. If the foundation cracks, everything above it starts to shift or weaken. By stimulating and strengthening this foundation, you stabilize the structures that allow erections to be reliable. Massage acts like a reminder signal, telling the foundation, stay active, stay strong. In practice, I often advise men to combine perineal massage with simple pelvic floor exercises. Imagine stopping your urine mid-flow. That contraction is your pelvic floor. Practicing it daily along with massage creates both strength and relaxation. Strength helps you maintain firmness. Relaxation helps you avoid tension and premature ejaculation. Together, they create balance. The takeaway here is that the perineum is not just skin, it is the front door to a powerful network of muscles. By paying attention to this area, you support not just your erections, but your bladder control and overall pelvic stability. Comment below if this resonates. Let us open this conversation. Men rarely talk about pelvic health, but the truth is every man over 35 should. In the next section, we will look at something equally important, how the nervous system and the brain tie into perineal stimulation and performance. Up to this point, we have focused on blood flow and muscle activity, but erections are not just plumbing and mechanics. They are also deeply neurological. In fact, your ability to get and keep an erection depends on a delicate conversation between your brain, spinal cord, and the nerves in your pelvis. The perineum is one of the main junctions in that conversation. The pudendal nerve, which I mentioned earlier, is like the main power cable carrying signals between the brain and the genitals. It runs directly through the perineal region. That means when you apply massage or gentle pressure there, you are not only improving circulation, you are stimulating nerve endings that send signals back to the spinal cord and brain. This can enhance awareness, sensitivity, and coordination of the erection reflex. Why does this matter? Because many men with erectile dysfunction are not dealing with a lack of testosterone or even poor circulation alone. They are dealing with what researchers call neurogenic dysfunction, a disruption in how the nerves fire and communicate. Sometimes this comes from diabetes, which damages small nerves. Sometimes it comes from pelvic surgery, and sometimes it is simply from stress, tension, and disuse. The National Institutes of Health notes that stress and anxiety alone can create enough disruption in nerve signaling to impair erections even when blood flow is adequate. Perineal massage helps here in two ways. First, by providing direct sensory input to the pudendal nerve, it acts like physical therapy for the nervous system, reminding it how to fire. Second, by calming tension in the pelvic floor, it reduces overactivation of the sympathetic nervous system, the fight or flight response that often sabotages erections. When the sympathetic system is dominant, your body prioritizes survival, not reproduction. When you calm it through massage, breathing, or mindfulness, you give the parasympathetic system, the rest and restore branch, a chance to take the lead. Erections are a parasympathetic event. Without relaxation, arousal cannot flow. Think of it like resetting a circuit breaker. If the lights in your house flicker, sometimes all it takes is going to the breaker box and flipping the switch. Perineal massage paired with relaxation breathing can act as that reset. It tells your body this is a safe state. You can allow blood flow. You can allow arousal. Clinical reports back this up. In men with chronic pelvic pain or pelvic floor dysfunction, therapies that combined massage, nerve stimulation, and relaxation showed significant improvements in both pain reduction and erectile function. It is not magic. It is neurology. So the takeaway from this section is this: erections are not just physical, they are neurological. By stimulating the perineum, you are retraining the nerve pathways, calming the stress response, and resetting the reflexes that allow erections to happen naturally. If this is bringing clarity, consider subscribing for more grounded, shame-free health content, because in the next section, we will move into something practical: how to perform a safe 1-minute perineal massage step by step. Up until now, we have explored the why, the anatomy, circulation, muscles, and nerves. Now let us move into the how. Many men hear about perineal massage and either avoid it because it feels mysterious or try it in ways that are not safe or effective. What I want to give you here is a medically informed, step-by-step way to practice it that you can integrate into daily life. First, positioning. The simplest way to access the perineum is while lying on your back with your knees bent or sitting comfortably in a chair. You want your pelvic area relaxed, not tense. Some men even prefer to practice in the shower, where warm water relaxes the muscles and provides natural comfort. Second, pressure. The perineum is sensitive, but it is not fragile. Use the pads of your fingers, not the tips. Apply gentle but steady pressure, similar to what you would use to massage your temples when you have a headache. This is not about pressing hard. It is about consistent, soothing stimulation that awakens the underlying muscles and nerves. Third, technique. Start by pressing lightly in the center of the perineum, the space between the scrotum and anus. Hold for 3 to 5 seconds, then release. Repeat this a few times, focusing on steady breathing. Next, you can apply small circular motions, again with light to moderate pressure. Imagine you are reminding this area to wake up rather than trying to force a result. Fourth, timing. 1 minute per day is enough to start. Think of this less as a workout and more as a daily reminder to your body. Over time, some men may extend it to 3 to 5 minutes, especially if combined with pelvic floor contractions or relaxation breathing. But consistency matters more than duration. Fifth, safety. Avoid massage if you have an acute infection, significant pain, or recent pelvic surgery unless cleared by your doctor. If you notice discomfort, back off the pressure. Remember, this is meant to be supportive, not painful. Medical literature supports these kinds of self-care practices. For example, pelvic physiotherapists often teach men with chronic pelvic pain to perform self-massage of the perineum and surrounding muscles. Studies published in the Journal of Pain Research show that when men integrate this into a broader routine of relaxation and exercise, symptoms improve significantly. Think of it like flossing your teeth. 1 minute a day seems trivial, but over weeks and months it prevents buildup, improves health, and keeps things functioning smoothly. Perineal massage works the same way, a daily investment in circulation, muscle tone, and nerve activation. The key takeaway here is that perineal massage is safe, simple, and effective when practiced correctly. It requires no special equipment, no expensive supplements, and no invasive procedures. Just you, your awareness, and one intentional minute each day. In the next section, we will go even further, exploring how lifestyle choices like hydration, nutrition, and stretching can amplify the effects of this practice and support long-term erectile vitality. Perineal massage on its own can be powerful, but like most things in medicine, it works best when paired with a healthy foundation. Erections are not isolated events. They are reflections of your entire cardiovascular, hormonal, and neurological health. So let us look at some simple, evidence-backed lifestyle adjustments that amplify the benefits of perineal massage. First, hydration. Blood is about 50% water, and erections are 100% dependent on healthy blood flow. Even mild dehydration thickens the blood and reduces circulation to small vessels, including those in the penis. A study in the Journal of Nutrition showed that men who were even slightly dehydrated reported more fatigue, poorer mood, and reduced physical performance. Keeping water intake steady throughout the day, not just gulping at night, ensures that when stimulation occurs, your body has the fluid it needs to deliver oxygen-rich blood to erectile tissue. Second, stretching and mobility. Sitting for long periods compresses the perineum and tightens the pelvic floor. Over time, this creates tension, reduced blood flow, and sometimes nerve irritation. Simple stretches like hip openers, pelvic tilts, or even walking briskly for 15 minutes can counteract this. Think of movement as circulation's best friend. Just as massage wakes up the perineum locally, stretching wakes up the pelvic region globally. Third, nutrition. Certain foods support vascular health, which directly translates to erectile health. Dark leafy greens supply nitrates that boost nitric oxide, a natural vasodilator that relaxes blood vessels. Berries provide antioxidants that protect the lining of arteries. Nuts, particularly walnuts and almonds, give healthy fats that support testosterone production. The Harvard Medical School has consistently emphasized the Mediterranean diet as protective for both heart and erectile health, because what benefits your arteries benefits your erections. Fourth, stress management. Remember, erections are a parasympathetic event. They require relaxation. Chronic stress, unresolved anxiety, or sleep deprivation all keep the sympathetic nervous system in overdrive. Practices like deep breathing, meditation, or even slow walking outdoors reset the balance. Pairing perineal massage with a few minutes of slow breathing is a clinically simple but powerful way to combine physical and neurological support. Fifth, medical partnership. While self-care is powerful, it does not replace medical guidance. If you have persistent erectile difficulties, a screening for diabetes, cardiovascular health, or hormonal imbalance can reveal underlying causes. Perineal massage can be part of your toolbox, but your doctor can help you integrate it with broader health strategies. The bottom line is this: think of perineal massage as the spark, but your lifestyle is the fuel. With hydration, mobility, nutrition, stress control, and medical partnership, that 1 minute of daily attention becomes part of a comprehensive system that protects both your potency and your long-term vitality. So far, we have covered the science, the practice, and the supporting habits. In the conclusion, I want to tie it all together to remind you that while erectile challenges are common, they are also manageable, and you have more control than you may think. We began this session by addressing a common myth that there might be a single hidden trick to restore male potency. What we have discovered together is more powerful than a myth. It is science, anatomy, and practical self-care that any man can use. You now know that the perineum is not just a strip of skin, but a central hub for circulation, nerves, and muscle activity that directly supports erections. You have seen how this region connects with the prostate, how massage can reduce congestion, and how activating the pelvic floor improves both stamina and bladder control. You have learned that erections are not just physical, but also neurological, and that perineal massage helps reset the nervous system's reflexes. And most importantly, you now have a safe 1-minute daily practice combined with hydration, movement, and nutrition that can support both your potency and your overall vitality. Here's the truth I want you to carry with you. Erectile changes are common. They affect at least 1 in 2 men.